Welcome to Let's Talk Climate. I'm Ben Fulgencio-Turner, the Director of Climate for Health at ecoAmerica. And today we'll be talking with Dr. Diana Hamer, the Director of Climate and Crisis Preparedness at the National Network of Public Health Institutes. And our subject for the day is right in our field of expertise, climate and crisis preparedness. Thanks so much for being here. Could you start by telling us a little bit about National Network of Public Health Institutes, NNPHI, and your work there?
Yes, good morning. I'm very happy to be here with you today, Ben. I've been with the National Network of Public Health Institutes for about 8 months now, and I am the Director of Climate and Crisis Preparedness. And for those who are not very familiar with NNPHI, we are the nation's membership organization for public health institutes. So public health institutes are non-governmental organizations that implement public health policy and programs across the 50 states. So we were founded in 2001. We started with 19 public health institutes, and currently we are over 47 public health institutes, and we're helping launch 3 more in Utah, Missouri, and New Jersey. So our reach has grown, definitely. We're also 10 regional public health training centers, and we support the National Coordinating Center for these public health training centers, and those are solely focused on supporting workforce development needs.
Right.
Again, everything is region specific, so both public health institutes and our training centers work directly within the region, the geographies, the community to really identify and serve the needs of the communities. In terms of our preparedness work, most of the work that started within NNPHI came from the 2018 crisis funding that the CDC put out due to the 2017 hurricane season that included Harvey, Irma, and Maria. So really impacting the Gulf South as well as Puerto Rico. And this allowed us to establish the Hurricane Response Hub across the Gulf South and Puerto Rico, with the goal to really enhance the inclusion of environmental health and occupational health into preparedness and recovery for hurricane-affected areas. So since that work started in 2018, we've established what we now call the Climate and Crisis Preparedness Portfolio, and we are committed to really expanding climate adaptations and other environmental health efforts throughout our network. So one of the examples of that work is obviously this partnership with ecoAmerica and the Climate for Health Ambassador Trainingship that we just hosted together. And we've also recently received the Public Health AmeriCorps grant in which we are going to onboard 10 climate fellowship members and hopefully expand this work across our network.
Well, that's really exciting. And I'll just say that everyone at ecoAmerica is so excited about the partnership with NNPHI. Like you mentioned, we did the Climate for Health Ambassador training live a few weeks ago, I guess a month or so ago. And really just having a focus on the links between public health and climate change and the different actions that public health workers and organizations on the ground can take is so inspiring and motivating. And we're going to have the on-demand online version available later this fall. So working on it now. And we know that just having public health leaders take action on climate, both adaptation, mitigation, and prevention and communication, is really necessary for our public health as we experience all of the effects of climate change, and also vital to communicating to people the reality that having these respected leaders in the community that aren't seen as partisans in the climate change wars, but seen as respected leaders on public health, on our shared common good, that having them out in the field, working on these issues in practical, local ways, just incredibly valuable for pushing forward collective action. So again, we're just really excited. So I guess diving into our conversation, the September is National Preparedness Month. And not coincidentally, it's also the peak of hurricane season. And you've already mentioned some about the Hurricane Resource Hub that you've worked on, but I'll expose a little bit of my own kind of East Coast bias. That I have family throughout the entire Eastern Seaboard, from the Mid-Atlantic all the way down to the Gulf and the Caribbean. I know that you're in New Orleans, and so can't start talking about hurricane season or National Preparedness Month without thinking a lot about these big storms coming through. So could you talk more about the work that NMPHI and local public health institutes are doing to prepare for hurricane season?
Yeah, so hurricane season, as I mentioned, the Hurricane Response Hub was a direct effort to incorporate public health into disaster preparedness. So the strength, I believe, of our public health institutes is that they are embedded within the communities and they work with stakeholders and partners in the regions and can really understand the needs of the organizations, the communities, and the individuals. So as part of the Hurricane Response Hub, our biggest success was the fact that each one of the 5 hubs was able to really design, implement, develop what the community needed at the time, right? So we established 5 technical assistance centers throughout the Gulf South, which are still standing. And within those training centers, about more than 400 trainings were developed. So each hub was specific to the needs of the community. So Texas really focused on including public health in emergency management training, as well as the role of public health during the response. While Louisiana focused much more on crisis management and crisis collaboration, as well as staff support. So Louisiana having a long history since Hurricane Katrina, a lot of work they've done, their needs were much more about cross collaboration compared to some of the other regions in our hubs. Another example is Puerto Rico. They really focus on trainings around certification of death, as well as how to document disaster-related deaths. And one of the successes is that they actually now have a state mandate or territorial mandate that any provider has to take these courses in order to prepare and respond to not just hurricanes, but any climatic disaster. So the work that the public health institutes are doing within the region is ongoing, and definitely when it comes to preparedness, as well as with COVID, depending on the relationships, the connections, the work can be very different. And I think that connection with the community and the stakeholders is what we're really trying to leverage in pushing more climate-related and emergency preparedness work throughout our network. Because from sitting at a national level or being a organization that just has say 1 or 2 offices, there's up to so much you can do, but really leveraging those boots on the ground and that regional local knowledge has really is really a model that can exploit really getting good work into the community when it comes to adapting to current climate change challenges.
That's really great.
Well, the reality of climate change is happening. So it's not the challenges that are coming, it's the challenges that we are already facing.
Yeah, that have arrived and that we're all, facing in different ways, but doing it in a more coordinated and better planned way. So I guess kind of thinking from the perspective of local public health workers or people committed to public health work, even if they aren't at an institute or if they're just in a hospital and are committed to public health. If they are in some of these areas that are at high risk from the intensifying hurricane seasons and severe weather, what are the kind of first steps to do around building that kind of resilience or coordinating with other stakeholders? So
a lot of the work historically when it comes to environmental disaster is very reactive. And I think what we're really pushing for, and any organization, big or small, and community should really be focusing in, is what are we doing to prepare? So it can look obviously different at different levels, but the first thing is, do you have a plan if you're an organization? But if you are at one of our public health institutes, or if you're at the health and local health department level, do you know who your stakeholders are, right? So responding to a crisis is not just about awareness, is how are people staying safe? How is messages being communicated? If you need help, how can people get out? So really understanding your geographic needs, I think is primordial, but also moving the conversation away to, when we're not in hurricane season, before hurricane season, already start having the conversations of who needs to be at the table. If they're not at the table, why not? And what do you need to do to start engaging every partner? Because when it comes to crisis, everybody has a role to play. So a lot of our public health institutes, a lot of the health and local health departments are moving the conversation to a proactive planning rather than a reactive planning. I think within a community and an individual level, individuals themselves need to have a plan, and communities need to understand what the pros and cons are, like what the strengths are, what the weaknesses are, and also know who the members of the community are. So again, this is extremely important for local and state health departments, because our population demographics are also changing a lot, right? So in the past, maybe 20 years ago, the people that had mobility issues or couldn't evacuate themselves during a disaster was much lower than it is right now. So we have an older population, we have more mobility issues, we have a lot of people with multiple chronic diseases. So you can't just pick up and evacuate, you need to have your medical supplies, and you have medical transportation. So understanding how your communities are changing, and these communities are changing because of climate change too. A lot of climate migration is happening nationally, is also essential in how you prepare and what stakeholders you bring to the table.
Yeah, and I think that, especially thinking at the institutional or organization or community level, September is Preparedness Month, but if now is when you're starting, you're preparing for next hurricane season. This is not you can't do it all of a sudden. Yeah, it takes months and months or years to really build together real preparedness.
Right, because relationships take time. And
Yeah.
when it comes to preparedness, leveraging those relationships, like if you know each other, you can pick up the phone and call somebody. But if during a response is when you're actually picking up the phone for the first time, that's when you might not have somebody on the other end picking up. I think what COVID has also shown us, because we've had some disasters during COVID, so it's almost like disaster upon disaster, is that the definition of who the public health frontline person is, and just who the frontline person is changing as well, right? So UPS drivers or medical drivers that bring medications to people, like, are we redefining that who the public, who our frontline personnel is, who is carrying the brunt of the response when a disaster is happening, and also what are we doing to support those people. So COVID has really brought up a lot of these topics, which are good conversations to have, but not only is our population, our community changing, but also who we consider responds and who is essential, and who keeps populations safe and healthy during the crisis.
Yeah, I think that all of these, we started talking hurricanes, but all of this obviously applies across all kinds of different disasters or crises. And yeah, I just want to dwell on the point that you brought up about of how that's such a long crisis of COVID, where we really got embedded some of the language of crisis into everyday discussion of first responders, essential workers, and getting a more discussion of risk and risk tolerance. That I think that it is you can get numb to it. It gets normalized. You can get numb to it after a while, but it is helpful that, there is more of a shared vocabulary around what emergencies and crisis looks like, that I think that we'll all have to be more familiar with as it becomes more common for there to be multiple crises at the same time affecting communities.
Right.
So I think that the other point that I wanted to ask you about, besides just kind of the work that public health workers and public health minded people can do on the ground, you alluded to, was what you can do as an individual to prepare. So as we look around at the risks that you face in your own communities, whether it's hurricanes or wildfires, inland flooding, or just the electrical grid shutting down due to heat waves or cold waves, what kinds of actions should individuals be taking to prepare?
So I think at an individual level, there's always the preparedness toolkits, that I think a lot of times when people think preparedness, maybe you have a generator, you have water and food supplies for X amount of days. In Louisiana, our electrical company is kind of giving advice of, if it's a Hurricane 1, expect to not have power 5 days. And it goes up depending on the category of the hurricane. So the basic principles of preparedness, so do you have food, do you have your medications, do you have enough water to last you at least until either the storm passes, and considering that the storm could pass and you could be without power for a week, 2 weeks. You also need to know your evacuation routes, because all cities, all localities will have available online if there's a mandate to evacuate the city. Basically how the flow changes in the highways, and you need to be aware of this. You also need to be aware that if you have transportation issues and you have to evacuate, who's going to evacuate you, if the city has a plan, if you have a neighbor that is aware of your condition and they would not leave without you. You can't have these conversations when they're packing up the car, right? You have to have these conversations ahead of time. And I think also it is your community responsibility, like pick up the phone and call a neighbor or call a colleague, call your family to make sure that you know what their strengths and weaknesses are. Maybe your neighbor has a generator, but maybe your other neighbor doesn't, is wheelchair bound. So being aware of your local strengths and weaknesses within your community can really help you plan, and also always listen to whatever is being mandated by state authorities. So if they'll say it's safe to stay in place, then that's an option you can consider. But if there's an evacuation mandate, you do have to get out. You have to try your best to get out.
Yeah, and I think it's really helpful advice, not just to think about what you need, what your family needs, but then also starting to reach out to your neighbors and community, both to see where they can fill in gaps and help you out, make sure they're aware of any special needs you have, but also figuring out what they need and if they have any gaps. And a lot of, talking about this is how you end up building both community resilience and individual resilience. Your neighbors are much more likely to buy enough water to last a week if they've had a conversation with you about it and realize, you're not necessarily a prepper, you're not a super paranoid person. This is just a reality that we and being prepared is part of what you have to do. But building that combination of individual and community resilience and preparedness, still it's work, it's relationships, it takes time. It's not as heavy as a lift at the kind of institutional level that we talked about before. These are things that can happen pretty quickly with a little bit of effort and relationships. Yeah. Great. So I think that I do want to touch one more time on that kind of institutional work. So you discussed the need for public health organizations to connect with and build relationships with other stakeholders and organizations. Could you give an example of that kind of relationship and coordination, either between public health and other institutions?
So I think what COVID has demonstrated is that public health and emergency management, emergency preparedness, they're still operating in silos. So they're still very reactive. There's still not a lot of overlap when it comes to the language or the lingo or the expertise that both fields need. But in terms of a crisis, everybody's kind of thrown into the same arena. So public health people end up doing a lot of emergency response work, and a lot of our frontline staff, emergency personnel, even if they're not aware of it, they are doing public health work. Right. So I think we've had instances, for example, with our hurricane hub, I know that some of the communities of practices that Texas set up allowed for that cross learning within and between departments, right? So you have public health people with emergency management people learning from each other, but also realizing, you had this crisis, we were not aware that that is something we had to prepare for. For example, like, most people are not willing to evacuate without their pets, and then,
Yeah.
we hadn't realized that that's something we had to prepare for. So I think breaking down those silos and having those conversations and having this space where we can learn from each other is a way that our public health institutes have really pushed the conversation forward. Currently, there's much more opportunity to get much more of this work going. So recently, the CDC put out that $3 billion investment into the infrastructure and workforce development of public health. And that's really providing opportunities for health departments to hire more personnel, but also to bring in the partnerships and the stakeholders and the technical assistance to continue to break down some of these silos and to really invigorate and support the public health as well as the first frontline responders workforce. So I think that we're actually moving into an area where much more of this work is going to become the norm, and what we really should be striving for is to continue pushing the agenda on preparedness. So my hope is that with this CDC investment, as well as the big IRA initiative that was just put out there, that public health is always part of the conversation, and it always happens proactively. And I do hope that with that investment, because it needs to be a sustained investment, there will be many more examples that I could be sharing, in a few years that really speak to what it means to break down those silos and address the people's needs from a all stakeholders on the ground type of response, rather than the more reactive model that we've seen.
Yeah, I know that there's so much excitement about the Inflation Reduction Act around its investments in the IRA and its investments in clean energy and building that entire field, but also, investing in these systems, in these local systems of response, adaptation, and resilience is extremely important. Anything that you wanted to add on that? I know that you mentioned a little bit about just the opportunities that it offers through that additional investment.
Yeah, I think what's exciting with the IRA is that you really start linking climate. Like, you can't unrelate people's health, so the public health, from what's happening with the climate. So throughout the announcements, there's language about climate and health. So I think it kind of starts changing the conversation and normalizing that where you live and your built environment and natural environment in any type of climatic event is going to impact your health, and it's a public health problem. And my hopes is that this will also bring public health to the table in every conversation, even when it comes to the built environment, to infrastructure, because there is a direct correlation with the ecosystem and the built environment and people's ability to thrive. So I think it's very exciting. I am very eager to see where the money ends up going, like who ends up getting basically the pieces of the pie, because I think that's also going to signal where they see the most need and where the investment is going to be. So it's very promising, but I'm mostly eager to see where that funding lands and hopefully becomes sustainable, because it cannot be a one-time investment.
Absolutely. So I think that we both are really aware of the disproportionate harms that climate change causes to various historically marginalized groups, lower income people, people of color, a lot of people in rural areas. They're experiencing the effects of climate change earlier and more intensely, due both to systemic and structural issues, caused by things like racism and discrimination and forcing people into very specific segregated areas, so that these communities end up being affected first and worst. So could you talk about how addressing these issues of equity and these disparities are embedded into the public health work that your partners do?
Yeah, so I think you're absolutely right when it comes to tribal nations, to island states or territories, as well as farmers and ranchers and the communities that have a closer relationship to the land than, say something like Muslim has. They have been more impacted by climatic events and climate change. And they've also been impacted for longer, right? They've probably been seeing it and living it for much more longer than most people. I think now a lot of people, with the disruptions of our supply chains that happened during COVID, a lot of people are realizing how tight everybody is to the land, and how, a freeze in Texas can actually have an impact across the country. And I think where our public health institutes and the work we're trying to do when it comes to health and racial equity is that the information and the needs come from the bottom up. So rather than following a top-down approach of this is what you should be doing to become more resilient, or this is what you need to be doing to adapt or mitigate some of the impacts that climate change is currently having on you. The work we're doing within our communities to really inform what the communities need and what they see as their biggest challenges, to inform the work that gets funded. So I think a lot of federal organizations are starting to invest and see this too. I mean, currently there's an opportunity from the EPA and the Department of Energy to really strengthen and get those lessons from the community to support the work that they need when it comes to environmental and energy justice. That is very tied to some of the work that the Biden administration is doing when it comes to health and racial equity and justice. And I think that's where we can really leverage our work as public health practitioners, whether it's our member institutes or any other public health organization, is that we know the communities, we work within the communities, and to really start changing that conversation so that it goes from what they need to the funders rather than the other way around. And I think with that, at least, especially for those who are most vulnerable and have typically not had a voice, bringing those voices to the table and incorporating them, not just involving them, but really incorporating them in the solutions, is some of the work that we're trying to get moving within our well, a lot of the public health institutes already do, but to start making more of that, like making more of the standard of this is how public health does. And I think with the shift in,
level, yeah,
I think with the shift on how some of these funding opportunities, some of the language, including with the Inflation Reduction Act, you start seeing that there is a shift and it's starting to become an awareness that the top bottom doesn't always work and sometimes can actually have effects that you would have not wanted to see. So within NMPHI, we have close relationships through our National Coordinating Center with tribal organizations, our territories. So it really is starting to highlight those voices of our most vulnerable, which vulnerability also usually come hand in hand with not really having a voice. So their experience with climate change has been longer, and the knowledge is really what needs to be highlighted and how to address the problems that their own communities are facing.
Yeah, having those existing relationships, years long already, is going to be so valuable as we all try to catch up on things we should have done a long time ago, nationally, collectively, and having that there already is going to be really helpful. So I think that we're just about running out of time. Is there anything else that you'd like to share?
Yeah, I do want to highlight that, when we talk to preparedness and as insiders or experts, we have a lot to say, but it really is the people, the men and women who are doing the daily work and keeping the public safe and healthy, the ones who really be experts and are really doing all the work, but they're also the ones who are being most directly impacted by all the, not only the changes in severity, but the frequency of response, the amount of times that they have to be activated, the brunt that puts on their own mental health, that puts on their families and their own social connections. So I just want to highlight all the men and women out there who do the work day in and day out as the real experts, as well as the real ones who deserve to have a full month, just to try to make and listen to them. Yeah, that's what I want to highlight. Sorry, we want to highlight them. And all the work our public health institutes are doing. That's what we're doing.
Yeah. Big thank you out to anyone watching who is doing that work on the ground. Thank you so much. And we're gonna and hopefully we can work to elevate your voices. So it's not just us sending gratitude, but really creating a platform where you can inform that larger conversation.
You said it very well.
Well, and thank you, Diana, both for the work that you do and for your time today. It's really exciting work, and it's an exciting partnership between ecoAmerica and NMPHI. All right.
I'm looking forward to future opportunities.
Great. Well, thank you. And thanks to all the viewers for staying with us. Please engage with us online with the hashtag Let's Talk Climate. And be sure to subscribe and follow us for the latest thought leadership, resources, and episodes on climate action and efficacy. Thank you, everyone.